I'm Kunkel, a plastic surgeon in Fort Worth, Texas. A lot of people who are thinking about undergoing a facelift want to know how it's done. If you're one of those, you've come to the right place. Let's talk about it. I'm going to create diagrams using photographs of one of my actual patients. At the end of the video, we'll show you before and after photos of that patient. When I do a facelift, I typically make an incision about like shown here, in the hairline in the front, just in front of the ear, and oftentimes behind the ear, and then sometimes along the hairline behind the ear. Once I've done that, I then will undermine, that's lift up the skin off of the underlying tissues. And then I'll grab those deep tissues and pull them. So in the neck, I pull it back, and in the cheek, I kind of pull it up and over a little bit. And as that happens, the skin moves with that and starts to overlap where the original incision was made. Sometimes I'll do what's called a deep plane facelift. In that case, I do a little less undermining, and then when I get to about where it's indicated here, I go a little deeper, a layer of tissue deeper than with the other technique, and maybe go a little further forward. Once I've done that, I grab those deep tissues and pull those up and back. In this case, I will often pull the tissues a little more upward than when I use the other technique. So what happens with that overlapping skin? Well, we remove it, we cut it off. And once we've done that, we suture the skin edges together. That results in a very fine scar, a lot thinner than shown here. And we'll show you this patient's result at the end of the video. See if you can see her scars. Some people also have these lines, these bands in their neck. What are those and how do we manage those? Those are actually the inner edges of what's called the platysma muscle. That muscle runs along the jawline and down to the collarbone in everybody, and sometimes those bands are pretty thick. When those are a problem, many times I'll make a little incision right here in a little crease under the chin. And then I go in and I'll take out a little wedge of that muscle to break up that band. And then in many cases I'll actually pull the inner edges of those muscles together. So as we pull those muscles together and we pull the neck muscle back, as shown previously, it really helps create a sling, a hammock, to tighten up the neck. There's a salivary gland deeper in the neck behind the platysma muscle. Some surgeons tend to shave off part of that. It may help a bit with contour. I don't tend to do that because of the risk of nerve damage and significant bleeding and maybe even leaks of saliva into the neck. I bring it up because there are some surgeons who do that, and you may hear about that. The facelift really tightens up the cheek and the neck, but oftentimes there's still some deep creases in, we call them the nasolabial folds, and around the mouth. So there are things we can do for that as well. Oftentimes we'll take fat from someplace else, maybe a tummy or a thigh, and inject some of that fat in areas as shown here. That can create a little more fine tuning of the result, a little more volumizing of the cheeks and the lips. Now let's take a look at this patient's photos from the front, from the side, and some oblique views. Those are the general techniques I use when I'm doing a facelift. If you've been thinking about a facelift, we'd sure love to see you in our Fort Worth office to talk about it. In Fort Worth, keeping it beautiful, I'm Kunkel.